The storm could not be coming at a worse time for Florida, where resources are already stretched thin amid a surge of coronavirus cases. Our lead national correspondent, David Begnaud, is in Miami. David, can the state handle another crisis right now?
Oh, look, Vlad, they'll tell you they can, but I'm reminded what the head of the Emergency Management Agency said to me 4 weeks ago. We are spending as many resources on this pandemic as we would normally spend on a Category 5 hurricane. Now, you just heard Lonnie. The projection as of now looks good, but Florida is preparing for a potential landfall just in case that storm starts to move.
We do expect to see impacts to the state of Florida.
The state of Florida's coronavirus response now includes managing a potential hurricane. At the Gladiolus Food Pantry in Fort Myers, Florida, the executive director is worried about the strain the virus is already putting on resources.
People are not prepared now for the pandemic. I don't even know how we're going to prepare if we have a hurricane coming.
Capacity is also a concern at Miami-Dade's hard-hit hospitals. Dr. David De La Zerda runs an ICU at Jackson Memorial Hospital.
If it's a big storm and you have sick people or injured people, we will have an issue where to actually put all these patients.
What's the situation in the ICUs right now?
So our ICUs are completely full, very young and sick patients.
Florida recorded a new high for coronavirus deaths for the third consecutive day. Arizona and Mississippi also reported record-breaking increases. And average daily deaths are rising in at least 17 states nationwide. And as millions of Americans apply for unemployment every week, some states are struggling to provide that assistance.
Many of the people in my district have had no income since March.
In California, the Unemployment Development Department is backlogged, so they haven't paid out more than 1 million unemployment claims.
You can start as early as 6 in the morning and be on the phone 12 hours.
Linda Margolin says she's waited 6 weeks for her unemployment check.
Right now, they probably owe me close to $5,000. I've received one benefit.
Look, when we think about parents getting back to work, we have to think about the children. There is new data from the Journal of the American Medical Association, which says young kids who are infected may have as much virus in their nose and mouth as us adults do. Now, remember, most kids do not suffer from severe symptoms, and it's unclear if having that much in their nose and mouth actually affects their ability to spread it to other people. Gail, as we've said and we continue to say, the doctors are still learning, and so are we.
I know this, nobody wants to take any chances with their children, but to think about COVID and a possible hurricane, David, it's just too much. Thank you very much.